Welcome back. Today we are demonstrating a knee joint aspiration for acute traumatic hemarthrosis. Our patient is a 21 years old male who sustained an undisplaced patellar fracture following road traffic accident. To facilitate comfortable and proper healing, we will drain the hemarthrosis before immobilizing the limb in cylindrical cast. Maintaining strict asepsis is paramount to prevent septic arthritis. We begin with a meticulous surgical preparation, painting the field with betadine followed by sterile draping to isolate the procedural zone. Accurate land marking ensures safe and reliable access to the joint space. Using sterile marker, we map out the patella. First, we draw a vertical line tangential to the lateral border of patella. Next, we draw a transverse line tangential to superior border of patella. The intersection between these two lines is our target point for superolateral needle insertion. Now we introduce a wide bore hypodermic needle attached to 10 ml syringe. We pass the needle in a scooping fashion, angling it down underneath the patella to enter the joint surface. Now the needle is in suprapatellar space, completely avoiding the bone. As we enter the joint space, you can see immediate flashback of dark non-clotting blood. In total, we evacuated approximately 100 ml of blood from the joint. Decompressing the hemarthrosis provides immediate significant pain relief for the patient and reduces intra-articular pressure. With the joint successfully decompressed, the needle is withdrawn and the sterile dressing is applied. We are now ready to apply the cylindrical cast to stabilize the undisplaced patella fracture. If you found this clinical demonstration helpful, please like, subscribe and leave any questions in the comment below. See you in the next video.